Hello, everyone. Welcome to today's Florida HIE Services webinar. We are so excited to have you here with us today, learning from our experts on the use of the encounter notification service for primary care providers. Just a little bit of housekeeping for those of you joining us today. You are on mute. However, in the questions tab, you can always go in there and ask questions as we go along and have our conversation. If there's time after the end of the presentation, we'll certainly try to get answers to as many of those questions as possible. So don't hesitate in going ahead and typing in questions for us to respond to as we move through today's presentation. My name is Pamela King, and I am the Health IT Outreach Coordinator with the Agency for Healthcare Administration, and I'm going to be facilitating today's conversation about the Florida HIE's Encounter Notification Service and how it can benefit primary care providers here in the state of Florida. And joining me here today are those experts I mentioned previously. First, we have Ashley Wells, and Ashley is a director with Audacious Inquiries, who is the partner with the agency for Florida's Health Information Exchange. So she is a part of our Florida Health Information Exchange outreach team, focusing on Florida providers and how we can get information to all of our providers here in the state of Florida about the patients that they serve. Prior to her work with the Florida HIE, Ashley worked with state HIE programs in West Virginia and Maryland, so she has a wealth of knowledge and experience to share with us. We also have Nicole Moore. Nicole is the Director of Care and Utilization Management at Aegeus Medical Group, which is comprised of over 34,000 at-risk patient population. Nicole joined Aegeus in September 2017 and developed a care and utilization management department from the ground up. She's a registered nurse of 13 years with a background in varied acute and subacute settings, and a U.S. Air Force combat veteran who spent 23 years in aerospace medicine, accumulating as an aerospace medical superintendent at the time of her retirement. Thank you, Nicole, for being here and for your service. Last but not least, we have Laura Myers. Laura is the Administrator of Clinical Services at Complete Health for the Volusia County and Flagler County areas, also known as the First Coast area. Complete Health is a primary care organization with a focus on value-based care. She has worked across various healthcare settings for 17 years with a focus on care coordination since 2016. Laura successfully developed and implemented chronic care and transitional care management programs in Florida that are now being used by the Complete Health company wide. She was also instrumental in developing patient-centered workflows and programming, enabling all Complete Health Florida locations to obtain patient-centered medical home accreditation, and that is no small feat. So, Laura, thank you. Welcome. What we'd like to do today is we're going to start out with kind of an overview of ENS for those half of you that really don't know what this encounter notification service is. We're going to have Ashley do an overview of the service just so you have more of an idea of what we're talking about when we get to the question and answer period. So, Ashley, I am going to transition the slides over to you.
Okay. All right. Thank you, everyone. As Pam was saying, it looks like the majority of you, or a little over half of you, do have some familiarity with ENS. So we'll try to keep this part short, sweet, and simple, so we're not boring you with details that you already know. But like Pam said, do want to give those that are not familiar with ENS a little bit of background on the product and how it works, where we're connected throughout the state, and all that good stuff. And then we'll kick it over to Nicole and Laura to really talk about how they're using it in their practices and what sort of value they're getting out of it, which is the most important piece. So with that, let's jump into it. You know what, Pam? It's not letting me advance the slide, so how about you just advance for me?
Okay, how about that?
There we go. So the Florida HIE is the official statewide HIE for the state of Florida, backed by the Agency for Healthcare Administration, who Pam is with. And my company, Audacious Inquiry, serves as both a software vendor for ENS as well as management services for the HIE on behalf of ACA. So you will hear oftentimes from myself and some of my other colleagues at AI that work on the Florida HIE team. The HIE works with hospitals, ACOs, payers, practices, post-acute facilities, and increasingly more government agencies and health departments across the state. So really any organization that is involved in healthcare and patient care in some way, we are working with. So by and large, ENS is 95% of what we do. It is our flagship service. We do a couple other small services around providing direct messaging solutions and help with onboarding to some of the newer national networks that have been popping up. But again, ENS, 95% of what we're focused on. And the name is exactly as it implies. It is a service that can notify subscribing organizations in real time of any patient that is attributed to them when they have shown up at one of our participating data source facilities like a hospital, SNF, home health, etc. And this information can be used to schedule post-discharge follow-up visits for enabling practices to bill for transitional care management, thereby increasing revenue and helping to keep that patient from being readmitted back into the hospital. So how does ENS work? We have our data source facilities, and those are the hospitals, the SNFs, the home health, the county health departments that we have real-time ADT interfaces set up with, and they are all the time sending us their data. Every time a patient is admitted, transferred, discharged, we are getting that information in real time and plugging it into our software ENS engine. On the other side of that, we have ENS subscribers. And then on our subscriber side, these are all the organizations that have said to us, we want to actually receive these alerts on our patients that we have a treatment relationship with. And so in this case, that would be folks like yourself who are in a provider practice or an ACO or health plan, and they want to receive alerts on their patients when they show up somewhere else. So every time a match occurs in our engine on one of your patients, we are going to send out an alert to you back to say, hey, Pam King was just in the hospital and just discharged yesterday, so you might want to follow up with her and get her in for a post-discharge visit. So who are we connected to throughout the state? We are connected to nearly all of the acute care hospitals. We are connected to nearly 90% of the rehab hospital beds throughout the state. We have about 150 SNFs that we're currently connected to and growing. Right now, we have all of the biggest SNF chains connected, and we're working our way down that list to the medium-sized ones at this point. So you will continue to see that list grow. We're also connecting quickly to more home health and hospice providers, as well as county health departments and EMS agencies. And I like to always encourage folks to go to our website to see a full list of data sources as you start to use ENS and really rely on the data. there might be a particular SNF in your community or a home health agency that you really do a lot of work with, and you might notice that you're not receiving alerts from them. And so the best way for us to grow our network and to be of ultimate value to our subscribers is for you to tell us that. Say, hey, County Road SNF down the street from me is not connected to ENS, and I'd really love to know when the majority of my patients go there. So I'd love to know when they're being discharged, and we can then reach out to that organization and work on getting them onboarded so you can start receiving alerts from them as well. And then in terms of our subscribers, which is what the practices would fit into, we have over 60 hospitals across the state that are receiving alerts back for a number of different uses, over 55 large provider organizations, nearly all of the ACOs and plans across the state, which totals to 13.5 million unique lives covered in Florida. And we're sending out almost 2.5 million notifications a month to our subscribers. So what type of information is provided in the ENS notification? You're always going to see the patient basic demographics, the facility, the originating facility where the event took place, the time, what type of event was it, where were they inpatient, outpatient, ED, physician, the chief complaint, any diagnosis codes, and discharge disposition. So over the years, we've been deploying ENS in a number of states now for about a decade. And during that time, we've learned that to really derive the most value out of these alerts, it's of critical importance that we deliver them to you in a way that makes sense for your organization and fits within your organization's daily workflow. So over time, we've developed a number of different delivery methods that we can send these alerts to you and allow you to pick which one's going to work best. The most simple and straightforward one from a practice perspective is our ENS prompt web portal, and that is simply a web portal that you sign into. It's a lightweight care management tool that you can manage just like your Outlook inbox, where you're going to have notifications popping up in real time as they come in on your patients. You click on one and it expands into all of the information and has some cool features that allow you to keep track of your follow-up and progress with each patient in terms of care notes and marking each with different statuses. We also can send them to you in a good old-fashioned Excel file on a real-time or a daily or weekly basis, whichever you prefer. We can send them to you in a direct message inbox. So in some cases, that is most of the time directly in your EMR, which makes it easy since you're working in your EMR all day, and every time you get an alert, it's going to be right there where you're getting all of your other email messages. And then last but not least, we can send it to you in an HL7 or FHIR formats, which goes way technically over my head, and I'm guessing probably over many of yours as well. And that's just a way for it to be directly ingested into your EMR. So what are the bottom line results that we've seen with ENS over the years? The most drastic result we have seen is reduction in hospital readmissions. Number of our clients over the years have just shown a huge reduction in readmit rates. From a practice perspective, we see an increase in TCM billing opportunities and thereby increase in TCM revenue as well. If you get a patient in within 1 week of discharge, it's allowing you to bill, Medicare allows you to bill anywhere from $166 to $235 per patient that you're getting in your practice after they've been in the hospital that you otherwise, would not be getting. We've seen improved management of chronic conditions over the years. Uncontrolled diabetics have improved. We have some cool features with ENS where we can send you smart alerts, which are curated alerts based on a set of criteria that you define based on your priorities. So if you're really focused on diabetes management in your practice and you only want to see, you only want to get alerts on your diabetic patients, then we filter out on those diagnosis codes and only send you those alerts, or we send you those alerts to a different place so they're separate from all your other alerts. And when you're ready to focus on your diabetic population, then you can only be looking at those versus your alerts of your total patient population. And then last but not least, we've seen improved quality measure and performance reporting, closing gaps in care, and things like that around, different value-based reporting and CMS models that have been put in place. And then the last thing I wanted to touch on is, because it's been a really big deal for us this year, is a new federal regulation that has come out from CMS as part of the interoperability and patient access final rule. And in this rule, Medicare updated their conditions of participation, which they don't often do. So it's kind of a big deal. And as such, they said hospitals must now send these encounter notifications to a patient's PCP, their SNF if they're going into one, and or any other doctor that they assert when they are in the hospital. And so this obviously has had huge implications for ENS and throughout the state in Florida. On one hand, we're really lucky because the majority of the states, the majority of the hospitals, nearly all of them, are already connected to ENS and already sending us that data. So it's a very easy, minimal lift for them to be compliant with the rule. And while all the onus is on the hospital to comply with this rule, CMS is indirectly saying, dear PCPs, we want you guys to also be set up to receive these alerts. So there, while providers are not going to get in any trouble if they're not receiving them, CMS is more or less communicating the importance of this data to the provider community and the importance of managing it. So we've really been on a big, been on a huge outreach campaign to start to better reach PCPs and individual provider level practices to get you guys better engaged. And then last but not least, just wanted to briefly touch on the onboarding process. If you are interested in signing up, it's very easy. It takes about 2 weeks. All you have to do is sign our agreement, return it back to us, and we schedule an onboarding call to talk about how you want to receive the alerts, what type of alerts you want to receive, how often do you want to receive them. You send us your patient panel, we load it, and then you're off to the races receiving alerts. So it's a pretty simple, straightforward process.
Thank you, Ashley. I think that was a great overview and really shared some good information about the benefits of ENS in general and how folks can get set up and registered to use that service. And so now I'm going to open it up to Nicole and Laura. Since I know Nicole is unmuted, I'm going to start with her. And so, Nicole, if you would, could you share with us just a little bit about your organization, your role there? I did an overview of your bio earlier, but also how your organization in that role, how you've utilized ENS.
Okay. First off, thank you so much for asking me to participate in this webinar. I was kind of shocked when you guys reached out to me, and it's quite an honor. I work for Aegis Medical Group. We are I would say a medium-sized internal medicine group that's comprised right now currently of 79 clinics between wholly owned, and we have quite a few affiliate offices scattered throughout Central Florida. We are actually also moving up into the North Florida area, and we are down into Tampa now as well. Of all of those practices comprised of those 34,000 plus, actually they're full financial risk patients that we are continuing to grow every month. So when I first started with the company, like you had said, I started building a care management department because there wasn't anything in place. And we knew nothing of the HIE. The way that we were identifying patients that were in the hospital was we had one person that was going into the hospital portals and physically looking for them. We had no idea if anyone was in the ER and when the patients were being discharged. So when we found out about the HIE and ENS, we jumped on it. And so myself and our VP of operations reached out to actually Aaron and Brian Smart and met with them, got some more information, and we were like, let's do it. So we signed up our wholly owned practices primarily and started with them just to kind of get a feel of how the system actually worked and how it could benefit us, how we could use it. So once we started using it for a few months and we found out that, wow, once the prompt came in play and we found out that, hey, we don't have to go in and physically look for patients anymore. This is kind of real-time data. And or we don't have to go into claim stuff to look, how the patients are utilizing the facilities. It was like an eye-opener. And so the doctors weren't so much involved with it at the time. It was more us and the few care manager nurses that I hired. So once we got really going with it, then I started going out on a campaign to market it to all of our affiliate practices and to tell them what a benefit it was. Some of them were getting notifications from the plans, or they were getting notifications from certain hospitals, but if they had a patient that traveled out of that local area, they had no clue. So that was the best thing about it altogether for us, was the fact that we were able to identify those patients that were outside of our local area of their PCP. Primarily the ones that were in the Orlando area where we had some affiliates, and we had no clue how the patients were utilizing those hospitals. So fast forwarding now, we have pretty much, I would say 80% between our wholly owned and our affiliate practices that have signed on with the HIU through us. And I now have a much larger team of nurses as well. So we also every day go in and tune to the prompt, and the office managers, the nurses, some of the doctors, but I don't think not too many. And we actually look for those patients, primarily the ones that are in the ER, because that's where our biggest gap was. We didn't have a presence in the emergency rooms, and we wanted to be able to capture those patients while they were still in the emergency room.
So it sounds like it was a pretty big transition for you, guys in getting that data.
It was huge.
And Laura, what about you? And share with us a little bit. Can you share with us a little bit about your organization and how you've been able to utilize ENS and implement it into your workflows?
Sure. So I can speak to the Florida market. Complete Health has practices in Florida and Alabama. I think we've got 24 or so providers in Central Florida and 58 in Alabama. And so HIE has been huge for us before. So I started transitional care management in January, and we started with HIE in the Florida market. So I never had to do all of that, going to the hospital portals and all of that stuff. We've just always had the HIE. Our Alabama practices, however, have had that. So this transition has also been really huge for them. But, we built a team of transitional care nurses, and we also are, on admission, making contact with those patients, trying to get to them or to the case manager in the ED as well. We also have patients that we are at full risk for and are going to be a DCE in April. And so we're working to make sure that we are following both the patient and the inpatient care team throughout the admission, and then that 31 days post discharge in a post acute setting, and then kind of giving them a soft handoff to chronic care management. So my team is using HIE a little bit differently than I am. We have a population health vendor, and so that's how we receive our notifications. And we have developed workflows for ED utilization to target high utilization patients for more frequent outreach. And just, it allows us to be proactive with mitigating patients that are high risk or high utilizers instead of waiting for exacerbations to occur. So we've been able to implement several initiatives that target those high risk patient groups.
Okay, so your focus is specifically on transition of care management after they've left the hospital, getting them in to do that follow-up.
Yep, preventing readmissions and all of that. Yep.
Okay. And when you said that you use a population health vendor, can you share a little bit more about that for our audience?
Yeah, so we, the HIE feed is amazing, because it gives us real-time access to what's going on with the patients. And each time, if a patient is transferred to another floor, there's an event, and you get that notification. So it allows us to kind of track what's happening with that through our population health tool. And then we created analytic dashboards to at my level, so that I'm able to create census reports and find out which PCP has the highest spend or the most frequent admissions, and we're able to look internally at our organization to see what improvements can be made there, on top of just being able to provide better care for our patients.
Okay. And then Nicole, you mentioned that you guys utilize the prompt service that is it is a user interface that is offered as part of an ENS subscription. Can you share with us a little bit about that and how you utilize that?
Yeah, the nurses actually go in every morning. Well, actually, my nurses and my CCM team go in every morning, and they're able to filter out, because some of my nurses cover multiple clinics. So they go in and they filter out to their specific providers, and then can identify those patients, like I said, that are primarily were either admitted overnight or are currently sitting in the emergency room. We're fortunate that in our Lake Sumter, Marion County, where the largest part of our patient population live, we have a hospitalist group that we own that handles patients in the 3 hospitals in those areas. So, but unfortunately, they're not in the ER. So, and I also have nurse navigators at each one of those facilities. So they also have access to the prompt, and they go in the morning too. So if they identify that that patient is in the ER, then they can go to the ER and try to possibly talk with the ER physician. And in some cases, we've been able to direct admit to a SNF, or even right back to the PCP office straight from the emergency room, preventing the admission. So that's been a invaluable tool as far as the prompt goes. And then the other nurses that aren't near the hospitals and are in the outer lying areas, they also use it every morning and go in and check for the same thing, the patients that were admitted overnight and the ones that are currently in the emergency room. And then they notify the physician's office as soon as they open to let them know, hey, your patient is in such and such hospital, or your patient is currently in the emergency room in such and such hospital. And then then the physician can reach out to the facility if they desire, to try to get the patient in. So that's primarily what we use it for, is more of just an alert for us so that we can start conversing with our hospitalist teams and seeing if we can get the patient from an admission, And then the discharge piece of it, because I do have navigators, they deal more with the discharge piece and the handoff part. So once the patient's already in the bed, we pretty much know what's going on from start to finish. And then we can plan for that transition for when the patient's getting ready to discharge from the SNPs and the hospitals. So that's primarily how we use the prompt right now. We actually just last month inquired about the email alert part, because the nurses and a few of the physicians were wanting to get some sort of notification so that they didn't have to go and just randomly go into the prompt and there might not be anything there. So we found out that we could do that. So we actually sat and I put a list together and we sent it up last month with our panel for the month to get those email alerts for the nurses and the physicians that actually wanted it. Hasn't started happening yet, but they're anxious to start getting those. So we'll see how that goes when that starts happening.
Yeah, that's great. And I love the fact that you guys receive data, the data in two totally different ways, but you still find it beneficial. And, and of course that you can receive it in multiple ways. You don't have to just choose one. So thank you for sharing that, Nicole. Laura, can you share with us a little bit about the actual impact of the encounter notification service? How has it helped your organization with that transition of care management that you're focused on and improving that follow-up and care coordination?
So, it allows us to prioritize patients based on the real-time data instead of trying to make predictions. So, it actually starts at a chronic care management. I feel like if you're managing patients at a chronic care management, you have a really good, robust CCM program, then your TCM admissions are going to be less frequent. But we didn't have any real data to go on. And so, now being able to have some almost a year's worth of history, we're able to kind of implement those initiatives. But in terms of from a transitional care standpoint, we're able to start working on discharge planning, on admission. Some of our HMO contracts, we've had issues with in terms of the length of time that it requires to obtain authorization and get patients signed up for home health care and actually get an agency assigned and a start of care date identified. So it's really been able to help us anticipate patient needs and make sure that everything is ready to go for them as soon as we get that discharge order. We also set up peer-to-peers with the providers in the hospital and our primary care providers so that we're able to say, listen, we're going to get them in within 72 hours of discharge. If you'll let them go home with home health care, and we can assure you that everything's being set up. So it really has helped improve our length of stay. It's helped improve our readmission rates. It's been really impactful from a financial perspective. And then also, again, just being able to provide the service to the patients where we weren't able to before because, we didn't have the means or the notification.
That's awesome. And then Nicole, for you guys, can you share with us how ENS has helped you guys with that care coordination and the overall impact?
I think for us, primarily, it has just been a valuable tool in actually identifying the patients primarily that were, like I said, outside of our local hospitals where we didn't have a hospitalist group or a nurse navigator in the facility. So that way that we could say, oh my goodness, this patient's in the hospital, here's what's going on with them. The being able to see the history and how many times that patient has utilized the facility is amazing. and helps you to like almost immediately identify those high utilizers so that you can maybe home in on them a little bit more when they do finally come home, and pay a little bit more attention to their transition and to see if they have any additional needs like social services or Meals on Wheels or something that's causing them to go to the hospital in the first place. So it has been invaluable to us for that part. And let's see, what was I going to say? And just helping to let the primary care providers know that your patient is sitting in the hospital, because a lot of them, surprisingly for us, didn't have any kind of notification. So, or they were getting something a day later. And the fact that the ENS was, and the prompt is more real time, was really a godsend, because now you can, like Laura said, you can kind of anticipate and kind of plan a little bit better. And even the nurses, even though they're not embedded in the clinics with the physician, they can kind of give a little bit of guidance to the doctor in some instances and say, okay, I see the patient's in with this, and they can review the chart and say, okay, maybe the patient needs home health, or maybe the patient needs something, or let's get them in a little sooner to see you. So they actually have been invaluable with helping the providers to actually be able to provide better and better patient care, and actually assist them with getting the patients into the office a little sooner than maybe they normally would, because they just didn't know. So that has definitely helped. Like Laura said, any tool that you can find that helps with decreasing readmissions and admissions and utilization is invaluable. And it has helped us dramatically over the last, I would say the last year, dramatically.
And so have you seen an improvement in overall patient outcomes?
I would say yes. Now with the our affiliate offices, it's a little bit more difficult because they are a little further out. So I'm not, with them every single day, but the nurses over time have been able to identify those patients via the prompt, and have actually been able to reach out to them and build rapport. So by building that rapport and that trust with the nurse care manager, then those patients that might normally go to the emergency room because they couldn't get into the office or whatever, we have noticed now that those people are starting to reach out to my nurse care managers now and present issues that they normally had really nobody to go to, because some of the offices are small, some are really big, and sometimes it's difficult. So just because of that, we have noticed decreases in admissions and have been able to decrease our MLR by like 10% over the last 2 years. So it's definitely helped in that area.
That's great. Laura, what about for you guys? Have you seen an overall improvement in patient outcomes?
Yes, I can echo a lot of what Nicole just said. I really wish that I had almost 2 years worth of data. We're just coming up on a year's worth of data from ENS. So, and I don't have that to go by. I'm hopeful that it will help decrease my MLR significantly. But for us, it the same thing, right? So our patients have developed these relationships with these nurses, and so instead of going straight to the emergency room or an urgent care facility, they have the nurse's direct line, and they're able to take those calls, and so the nurses that I have are on call 7 days a week, and there's always someone that's available to take that call, so that we're able to help facilitate appointments with other specialists. If maybe somebody needs to get in to see a urologist on a Friday afternoon, we're able to help make that happen so they don't end up being admitted for, a catheter placement or something like that. So I definitely see the benefit of them finding that comfort level with the nurses and utilizing this service. It's been huge.
So really that's been a big part of it. Patient engagement has been a big part of of what you're doing. It sounds like you're using the data to actually reach out to those patients and then building a rapport.
Yes.
That's awesome. You know, having that information so that you can do that patient engagement.
Well, it improves the relationship between the patient and the practice as well. You know, the nurse is an extension of the provider, and our staff is also embedded in the clinic. And so the patients come in and they meet these nurses with the provider, and they see the provider facilitating that relationship. And so in turn, it definitely improves you know, the patient experience and the patient satisfaction with the overall practice.
Absolutely. I know from being a patient myself, of anybody that's in the practice office, right? We affiliate with that provider. So I can definitely see how that would improve how patients look at the practitioner's office in that engagement. And so we're getting close to time. So I have one final question for each of you. Nicole, what recommendations do you have for other practitioners that may be thinking about using ENS?
I would say if you do not have a true real-time tool to track your patients that are going to the hospital, and especially if you're in a high-risk business model, I would highly, highly recommend signing on with the ENS, because it's going to close that gap. Absolutely.
And then Laura, for you, what advice do you have on how to use the service for providers that may be thinking about using it, how they can use it productively?
So, you know, for me, having the ENS data through a population health tool has been really helpful, just because of the ability to create and populate reports specific to the goals of my organization, and use that data to inform workflows for care coordination. So I definitely think, you know, look at your business model, look at your company goals, and utilize the data that you can get from the HIE to be impactful to your goals and towards your organization. But I definitely think using it in conjunction with a population health tool and reporting is huge.
Great. I think we have time for just a couple of questions. So if there's anyone in the audience that has a question for anyone on our panel, so Ashley, Nicole, or Laura, you can either click the raise hand button, or you can go ahead and type your question in the question pane. We have one question. Nicole, I'm going to direct it to you because I know you have the affiliated providers, and it's more on for smaller practices. How would you recommend they get started with connecting and utilizing ENS?
Well, what I did with my smaller practices was I actually went and I took the literature that you guys provided to us, and just sat and explained to them how beneficial it could be with just identifying, if nothing else, when the patient registers in the emergency room, right? So then, and how it would help them to watch utilization, to watch how their patients are utilizing the hospital. Are they utilizing it as the PCP? Are they having problems getting a hold of the office? What is driving them to the hospital instead of coming to the office? So for my providers, it was basically for those that did not have a tracking tool in place of any sort, or any sort of notification, and wanted one. And this was big help to them. And then I did all the contracting work for them.
That always helps.
Yes, that was a big deal. It's like, sign the paper, I'll take care of the rest.
Have Nicole do all the contracting now. But I will say with that, for smaller practices, it really isn't that hard to sign up to receive the alerts. So don't be afraid. I mean, Ashley's 4 little bullets of how to sign up for the encounter notification service. It really is that simple to be able to sign up. There are forms out on our website that provide information that can walk you all the way through the process, and you can always reach out to myself or Ashley for any information. And I do want to share that for our Medicaid providers, we do have funding to allow you to subscribe for the first year at no cost. So there is a cost for this service. We didn't really touch on that. So for the first year of the service, you can receive the encounter notifications for your patients at no cost, and that gives you an opportunity to build in the workflow around your patients, how you're going to get that information and actually utilize that information to improve care, work with that transition of care management, that sort of thing. So there is that opportunity for all of our Medicaid providers. And Ashley or myself can give you more information on that as well. And so, Ashley, another question. So what is the cost for the encounter notification? Do you want to take that one?
Sure. So as Pam mentioned, we do have the first year of covered funding for any Medicaid providers. And then after that, it would be $500 annual flat fee for practices that have less than 5,000 patients on their panel that they send us. And then for any practices over 5,000 patients, it turns into a per patient per year rate of 30 cents per patient, up to 50,000 patients. And then after 50,000, it drops to 11 cents per patient, I believe. If you're a smaller practice, you're just going to pay that $500 flat annual fee billed on a quarterly basis. And then if you're a little bit of a larger practice, we, like I said, we scale the cost based on the size of your practice.
Yeah, so very reasonable fees, especially for practitioners. And I actually do not have any other questions in our question pane. I want to thank our panelists so much for joining us here today. We truly, truly appreciate you taking time to share your wisdom with all of the practitioners here and everything that you've learned while using the service and providing information. Our contact information is on the screen now. For those of you that want additional information, you can reach out to us. With that, we thank you and we bid you a good day.